Hey there, have you ever heard of scleroderma? If you have, chances are that someone close to you has been affected by it, but you're not alone if you've never heard of it. Hopefully, as we discuss the forms of scleroderma and the problems associated with each of them, you will be more informed about this complicated disease. Scleroderma presently remains among the most misunderstood, misdiagnosed, and underfunded autoimmune diseases, and quite often, it is difficult to understand the magnitude of impact it has for those that are affected. So what exactly does scleroderma mean? Let's break this word into its components. Scleroderma is derived from the two Greek words sclero, meaning hard, and derma, meaning skin. It literally means the hardening of the skin, and this hardening is caused by the overproduction of collagen, which stiffens your skin. This disease is a progressive, autoimmune, and chronic connective tissue disorder. Essentially, it is a condition in which the body's immune system, which normally provides protection, is compromised and attacks its own tissues. As a result, this leads to inflammation and damage. We don't know too much about the pathogenesis, but some unknown factor triggers an overproduction of a body protein called collagen. Normally, collagen keeps the skin soft, but when you have an overproduction of this protein, your skin begins to thicken, harden, and scar, and in severe cases, this affects your internal organs. How prevalent is scleroderma? Scleroderma is found all over the world and affects all races. It has been estimated that about 2.5 million individuals worldwide suffer from scleroderma, of which women are roughly 4 times more likely than men to develop systemic scleroderma. There are two major types of scleroderma, localized and systemic, which further branch into other forms. One of the most common forms of this disease is localized scleroderma. However, it's the least severe in terms of its manifestation, as it mainly affects the skin and does not affect surrounding organs. This is the only type of scleroderma that can possibly stop progressing without treatment. It takes one of two forms, morphia or linear. Morphia is described as firm, reddish, oval-shaped patches of skin that are thickened and appear on the body. These patches have very little sweat and hair growth, and there can be a single patch or multiple patches located on the body. It is most commonly found on areas such as the chest, stomach, and back. The second type of localized scleroderma is linear. This type of disease is characterized by a single line or band of thickened skin. Typically, the line runs down an arm or leg, and in some rare cases, down the forehead. Now let's take a look at the other type of scleroderma. Systemic scleroderma affects the skin and major organs. It is further divided into limited and diffuse. Systemic scleroderma can have many different presentations, and it is important to realize that these symptoms may differ among patients. People with limited scleroderma often experience all or some of the symptoms known by the acronym CREST. C stands for calcinosis. These are when white lumps made up of calcium form under the skin. These lumps usually form around the fingers but can occur anywhere in the body. At times, these lumps can rupture, causing the secretion of a white material. Keep in mind these lumps are not caused by increased intake of calcium in the diet. R is for Raynaud's phenomenon, which is a condition where blood vessels constrict due to the cold environment or emotional stress. This leads to color change in the digits. E is for esophageal dysmotility. This is where the esophagus becomes less active and the muscle function diminishes. Over time, this could lead to the muscle being replaced by scar tissue, and it results in difficulty swallowing, heartburn, and bloating. S stands for sclerodactyly. This is when one experiences localized thickening and tightness of the skin in their fingers or toes. Typically, the fingers tend to tighten in a bent position, and this condition can lead to the manifestation of ulcer. Last but not least, T is for telangiectasia, also known as spider veins. This is when small red spots appear on the surface of the skin, caused by enlarged and damaged small blood vessels. These are usually found on the fingers, palms, faces, lips, and tongues of the individuals that are affected. Now let's take a look at the second type of systemic scleroderma. 40% of systemic scleroderma patients have diffuse scleroderma. This condition typically occurs suddenly, and it begins with the skin thickening in the hands, and it then quickly spreads to the rest of the body. Diffuse scleroderma patients face the serious long-term effects of it. This type is more likely to be associated with progressive lung fibrosis, scleroderma renal crisis, and significant GI disease or cardiac disease. Check out the second part of this video discussing about the management of this disease. The link is provided in the description below. Thank you for watching this video brought to you by the Hamilton Scleroderma Group and the Demystifying Medicine series. If you enjoyed this video, please like, share, comment, and hit the subscribe button to check out our other videos.